Last month, a UNICEF expert, Maria Ozbek, spoke about the effects of climate change on children of Central Asia. So, joining us today, we have a special guest from UNICEF, Sagitjan Aytjanov. Hello and welcome. Could you please introduce yourself and tell about your expertise?
Okay, I'm Sagitjan Aytjanov. I work as a program officer on water sanitation and hygiene at Unicef Country Office, and I manage projects in the Republic of Karakalpakstan, mostly related to the as a response to the environmental consequences of the Aral Sea.
So the Aral Sea problem has been existing for some time now. Can you tell us about this problem in general, some information?
Okay, the Aral Sea disaster, as you know, the Aral Sea has started shrinking since 1960s, and at this moment only 10% of the Aral Sea is available in the sea. So the drying up of the Aral Sea has a lot of multifaceted problems related to health, to environmental issues, and overall social problems it raised, and also it affected to the economic condition of population in the Republic of Karakalpakstan.
So, and UNICEF has been taking action for several years now in Uzbekistan as well. So can you tell us from what it began?
UNICEF is currently actively involved in a project in Karakalpakstan under the Multi-Partner Human Security Trust Fund, which has been founded in 2018 under the auspices of UN. UN established the Multi-Partner Human Security Trust Fund to make strategic decisions that will respond to addressing the challenges of the Aral Sea, both on human insecurities related to social insecurities, health insecurities, and environmental insecurities. So UNICEF started the projects in the Republic of Karakalpakstan since 2019, and the first project was related to the improving the perinatal services in the Republic of Karakalpakstan, targeting 3 perinatal centers in Nukus city, in Biruni district, and Kumrat district, and provided with medical equipment and lots of capacity building trainings for healthcare workers to support them in addressing issues to neonatal health.
So what was the result? Like how much the life quality improved after those projects implementation?
We can see that from the statistics that child mortality has decreased due to the support of UNICEF projects and also overall other UN agencies' joint efforts. And also under the 2 other projects were related to improving the water sanitation and hygiene in healthcare facilities and also in schools. So it also affected to the decrease of diarrheal diseases, soil transmitted helminthiasis diseases, which are considered as waterborne diseases.
Okay, so there are some projects ongoing now, right, in the Aral Sea region. Can you tell us about them?
So currently we are implementing the 3rd Aral Sea project, we call it, and the full name is Laying Foundations for the Water Sanitation, Hygiene and Nutrition services for the health and education facilities. And it is implemented by UNICEF, WHO, and the UNEP. And under this current project, we are mainly focusing on improvement of water sanitation hygiene in 10 schools and 16 healthcare facilities in 3 target districts. So we can call these target districts Kigili, Chimbai, and Karauzyak districts. And apart from that, we also conduct capacity building of healthcare workers and teachers, parents, and school children. And also under this project, we also included climate change adaptation topic. So we will train around 400 school teachers and 200 parents and 300 school children on climate change adaptation measures. We are currently working it in cooperation with GGGI project. GGGI is a Green Growth climate initiative, which also implementing in Karakalpakstan. So we are adapting the module, and based on which we are conducting training sessions for teachers and parents and school children. So also another part of this project is dedicated to the healthcare waste management, and in 3 district hospitals we will construct a healthcare facility and also install the ecological, environmentally friendly equipment that will sterilize and make safe waste, and it will help to avoid hazardous toxins from burning in the incinerators, and it will positively affect to the environment and also to the population living in the surrounding of these hospitals. So another direction of this project is supporting the healthcare facilities with telecommunication equipment. So we have delivered and installed 19 sets of telecommunication equipment. The essence of this equipment is to ensure provision of better quality health services to the population. That means that the primary healthcare facilities located in the remote areas where there are no specialists on specific diseases, they can consult with the Republican level, in the level of Karakalpakstan, Republican level specialized healthcare facilities and get advice. At the same time, they can also refer to specialized healthcare centers in Tashkent. That way, we will ensure the consultation between the doctor, and also they can also present the cases of patients who have severe conditions, and the high-skilled specialists from Tashkent or in Nukus, they can provide necessary support. So through distance, remotely, so it is online.
Okay, so that sounds really exciting, and I hope those projects will help a lot to the region of Karakalpakstan. And
hope so.
Are there any projects for the upcoming year, since it's coming very soon?
Currently, we are also working on the Asian Development Bank Technical Assistance project. It is a regional project. It includes not only Uzbekistan, but also Armenia and Kyrgyzstan. So under this project, we are planning to, but it's at national level, but it will also affect to all of the Uzbekistan, including the Republic of Karakalpakstan. In this project, we are planning to review and revise WASH standards, water sanitation and hygiene standards. So that means as building codes, sanitary norms and procedures, and also standard operating procedures on healthcare waste management. That way we can ensure that UNICEF initiatives implemented in Karakalpakstan, which is considered as climate resilient and inclusive. Inclusiveness means that considering the children with disabilities. So it will be kind of disability friendly and also climate resilient. So these approaches which we are utilizing in the Republic of Karakalpakstan will be part of these WASH standards, and it will be broadly applied in the new constructions and also current reconstruction works, even if it is funded by the state programs. So that way we will ensure that better enabling environment for children at schools and also for the population in the healthcare facilities, so somehow mitigate to the climate change.
And why were these 3 countries specifically were chosen? What connects them?
So in UNICEF, usually at a regional level, there will be some regional projects where the countries apply, and then the regional office will select which countries has higher priority for those areas. That way they will be selected, and then we will get funding, and based on which we implement those activities we plan to do. So that's one part of this regional project, but also at the same time we are now under this project planning to conduct WASH knowledge, attitude, practice and norms study. So it will also be nationwide. We are planning to conduct interview survey for around 1,400 households, and that way we will get population knowledge, practices and the norms regarding the water, sanitation, hygiene, and based on which we are planning to develop a social and behavior change strategy, based on which we will conduct capacity building and awareness raising activities for the population in order to increase their awareness about water, sanitation, hygiene, and also somehow respond to climate-related issues. So these are the things that we are planning under ADB project, but also UNICEF is planning to implement another new project around 50 schools. We are planning to conduct this infrastructure improvement works, and also capacity building of implementing, we call it 3-star approach. So that way, not only the infrastructure, but also it will be complemented with capacity building activities to make this constructed infrastructure will be used sustainably and for longer term.
So now, can you tell us about how the problem of Aral Sea specifically impacts the population of Uzbekistan, life quality in Uzbekistan, and maybe even our neighbors in Central Asia? Because the Aral Sea shared the border with Kazakhstan, right? So it's a problem not only for Uzbekistan, but also Kazakhstan.
Well, overall, I wanted to say that the Aral Sea crisis is not the problem of Uzbekistan, but also it affects other Central Asian countries. And the nearest one is Kazakhstan, as you mentioned. And because of this crisis, you can observe that there are lots of dust storms. And also water scarcity is another issue, and also now the government is making afforestation measures to decrease the adverse effect of this Aral Sea by growing saxaul trees and on the dried bottom of the Aral Sea. So it has environmental issues like dust storms, adverse weather conditions, and the second impact of the Aral Sea is it impacts to the health of populations. For example, in the Republic of Karakalpakstan, the cardiovascular diseases is in the first place, and then oncological diseases we have. And also we have many respiratory infections widespread in Karakalpakstan, like asthma, and other respiratory infections.
Mm-hmm. So, do you think that if we don't combat this problem, the problems with air quality will also affect other regions close by, if the Aral Sea dries up fully, for example, in the future?
Yes, definitely. Nowadays, for example, the overall estimation is saying not only Karakalpakstan, it affects also the Khwarezm region and the Bukhara regions. So therefore, definitely we have to increase efforts towards combating the impact of the Aral Sea disaster. That means that one of the solutions is rational use of water resources. So that way, to provide water, to increase the water supply, And the other issue would be the government-led initiatives on afforestation. So the more green areas we will have, we might have less impact of the climate change. For example, nowadays in the summertime, you know that a lot of days we have over 65 degrees. Before we didn't have such condition, and also the precipitation rate is the number of rains also decreasing, so that is also impacting. That is also the impact of the Aral Sea crisis. And also the only way is rational use of water resources and providing sufficient waters is affected regions. And another solution would be greening of the territory, so afforestation of the dried bed of the Aral Sea. Also, another options we can say that they call it innovative solutions, like, for example, what we are using is for example, in the schools and healthcare facilities, in those communities, water is provided only 1 or 2 hours a day. That's why while we do the infrastructure projects, we install water reservoirs for storage of the water. That's one of the solutions, and the other solutions in the remote areas where there is no centralized water supply system, we drill the wells, and from the wells we install the reverse osmosis systems for the water treatment. That way we will provide population or even the schools, healthcare facilities with clean drinking water. So these are the few innovative methods, but also there are lots of other methods in agriculture that water saving technologies, there are plenty, like no-till planting and hydroponics, but the other UN agencies implement such projects. As UNICEF, our mandate is more related to children, newborn children and mothers. That's why we are more focused on the schools and healthcare facilities. That way we act on those areas.
Mm-hmm. So UNICEF works on the root of the problem, like where it begins with children, so that they will be healthy. And also, we have other organizations. You mentioned DGGI. We also had an interview with them, and I hope the collaboration was very fruitful. So we know that many organizations actually work on the problem for Aral Sea, the government, UNICEF, UN as well. But how can usual citizens, ordinary citizens of Uzbekistan or other Central Asian countries contribute to solving this problem, to making it easier for us?
Well, first of all, I think through awareness raising and behavior change communication, we can change the minds of the population. It starts from the rational use of the water, even at home, you know, during the hand washing, to spend less water, and also by teaching them hygiene, and also protection of the environment, like on waste management, and also we can also work with the private sector on recycling of the waste. That way we can they can support somehow contribute to the climate change related climate mitigation activities.
Mm-hmm. Thank you. I hope everyone will take a collective action towards solving the climate change issues in our country, in Central Asia, as the problems with climate change are becoming adverse every year. Mm-hmm. So thank you for coming today, for giving this a fruitful interview